So one of the biggest things about implicit bias is that it's implicit, right? It's not a reflection of a person's intent oftentimes. Um, as human individuals, we bring our all life experience to the things that we learn, that we train in, and then we apply that art or that skill in our professions. And so recognizing that, um, we're going to come to these kind of circumstances with that set of who we are. Now, the world is vast. People are multicultural, multidisciplinary. And so in order to bring a culturally sensitive and effective approach, it takes one, the intent, and then two, education around what implicit bias is and how it affects you. And so one of the biggest things is to raise awareness about implicit bias, and then to provide and offer and encourage um, folks to engage in training and to get a greater understanding of that. I personally believe that these are factors and pieces that should ultimately be a part of the training process for physicians and healthcare providers. Uh, and then another, I think, even higher, more highly effective way of attacking implicit bias is increasing representation of minority providers, right? By working with, alongside, and communicating with physicians of color, that experience helps bring into that context. I can have a conversation with you around some of the ways bias shows up, and and then that awareness for that person who has some implicit bias, right? Awareness of the bias can be factored into how they evaluate that circumstance, um, and then that gives a more accurate diagnosis, a more effective treatment. And so I think that at the level of provider, uh, that's probably the axes where we have, I think, the most direct and most broad impact, is to have the medical and healthcare community be more representative of the population it serves.